Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well on a beautiful, beautiful early March day. Sorry about the sun and reflection, but I didn't want to block out any of the sun right now in this room for the video because, actually, to be honest with you, it feels so good. So, hey, listen, here in March 2020, I had a very common experience in my office that I wanted to share with you because it's something that I take for granted, but it's very overlooked. And that is inflammatory effects in the body, but that can be mitigated and limited when you appreciate hormones and hormonal balance and hormonal optimization, okay? Particularly one hormone. So if you live in chronic pain and yourself, share this with others, share this with family and friends, loved ones, people you might think of, okay? Subscribe to our YouTube channel, follow us on Facebook, etc. Because I always bring you things like this that I see on a daily basis that seem kind of to me physiologically common sense, but things that often get overlooked, okay? You can miss the forest for the tree type saying. So here's the thing is if you live in chronic pain, that is inflammation, a neck, a shoulder, a knee, a hip, a back, any joint inflammatory reaction, okay? That joint damage, destruction, okay, albeit unless it's very severe like bone on bone, okay, has been going on for probably years, okay? What's happened though is now you put in an inflammatory response to the body. So there's inflammation in the blood and that then creates a pain signal, okay? So essentially microscopically it even can create some swelling to a joint and such, okay? Maybe a joint might feel warmer or hard to touch, or it hurts with movement or weight bearing, etc. Okay, but the inflammation itself is the root of causing the pain. Okay, not just the degenerative changes to the cartilage or the joint or the bone, what have you. Okay, so what is a very common hormonal thing that keeps your body less inflamed, keeps it more youthful, more anti-inflamed, keeps it functioning highly and optimally. And that is your adrenal hormones, particularly cortisol and to a lesser degree DHEA. But cortisol is an anti-inflammatory hormone. So a very kind of common word used out there, and it's thrown out often and sometimes legitimately, sometimes not, but adrenal fatigue. Yes, here at Longevity Health Institute, we treat tons of adrenal fatigue, tons of chronic fatigue. We find the root cause, we fix it, and people thrive, okay? They get back to like the vitality that they deserve and want to live, but because we get to the root cause. But here's the key thing. The key thing is this, is that you gotta fix what is the issue. And the adrenals are something you can't overlook, okay? So if you have chronic fatigue, you kind of drag throughout the day, midday you have a crash, you don't rebound maybe after stress events or after exercise and that, you definitely have some adrenal components, some adrenal issues. You're not making adequate cortisol. Cortisol is an anti-inflammatory hormone. It's an energy hormone. It's an immune hormone. So again, if you have pain, you have to look at and appreciate the adrenal gland and the hormone called cortisol. Now we do that here in a saliva test, sometimes even a urine test. But before I put people on supplements that are anti-inflammatory, like curcumin and omega-3s and ginger, and optimizing your vitamin D. I could go on and on. We want to look at the root cause. Why? Because if we're just using a Band-Aid to a therapy for pain and inflammation and not getting to the root cause, okay, what are we doing? Well, we're actually probably overlooking something that could develop into an immune issue in the body, could develop into illness, a chronic disease, something later, because why? The cortisol level is suppressed and it's very low. So you make cortisol when you sleep, you need it to thrive and survive, literally to survive, but you also need to have it for not having pain on a functional daily basis. So if you have pain in your joints, anywhere in your joints, you have to have your body looked at from a functional standpoint, that your adrenal gland and your adrenals making adequate cortisol, okay, which can be for many reasons why that gland's not working. We have to evaluate it. Is it coming from the pituitary? Is it coming from poor sleep? Is it coming from stress? things that we'd expect? Is it coming from bad nutrients and bad gut health? Is it coming from any type of physiologic or physical stress, okay, or too much exercise, etc.? But we need to evaluate why that's happening so that we obviously can get to the root of it and fix it. Fixing your adrenals, okay, and adrenal fatigue, say, and fixing your cortisol, and sometimes using DHEA, but also nutrients, mind-body therapies, proper sleep, sometimes other hormonal balance things to activate. What actually happens is now you fix the foundation of what the problem is, and you develop less pain. In fact, actually, people have told me they have terrible joints, like a bad knee or a bad foot. I had somebody today that actually had a capsulitis and a neuroma and bad arthritis in their foot and ankle, and literally told me that just by fixing the adrenals doesn't even bother them anymore. They don't even think about it. And they've had shots in their feet, they've had physical therapy, they've had freezing, cryotherapies, on, helped them minimally, and then it kept coming back. You fix the adrenals, they have less inflammation in the body, and they do well, they thrive. So then you can get back to being active and doing the things you love, sharing time and happiness and with friends and family and loved ones, the things that really matter in life. So again, see a functional practitioner like us at Longevity Health Institute. Me and my practitioners here are always open, new patients. Follow us here please subscribe to my YouTube channel. Follow us. I usually do a video at least every 3-4 days. Try to bring you some updates on what's happening in the office, what's happening in functional primary care, integrative wellness medicine, and also what's out there in the world. Probably soon we'll be talking about the coronavirus, I'm sure, but I'm kind of waiting on this because you never know what's going to shake out. It is coming to the end of the winter, and that will benefit us. But subscribe to the channel, follow me on Facebook, follow us, my practitioners, always bringing you the best in functional integrative wellness medicine. Be well.